Hi, my name is Dr. Taylor Versteeg and I'm a physiotherapist. Normally I'd be talking to you today about the importance of neck strength in reducing concussion risk. But today I'm putting these videos together with other people in mind, specifically my parents and my in-laws and my few dozen aunts and uncles. My parents were both from Dutch-Canadian farming families, so I've got a lot of them. There's a lot of talk out there about COVID-19 and the risk, and yes, it is a deadly virus, and specifically for those people that I mentioned, they're most at risk. The reason why it's such a deadly virus is because COVID-19 affects our respiratory system, that it clogs up our lungs, making it a lot more difficult to get oxygen into our bloodstream. What that means is it ends up making it a lot more work on our breathing muscles to help get the air in and out to get oxygen into our blood. And if it clogs up enough, we end up increasing the load on those muscles, which leads to respiratory distress. That's shortness of breath or apnea. And if that respiratory distress progresses into respiratory failure, that's when people need to be put on a ventilator. Unfortunately, if people are put on a ventilator, the average person usually before COVID-19 would only need to be on a mechanical ventilator for about 4 days. But after 3 days, the breathing muscles already start to weaken. And the problem with COVID-19 is that people are on the ventilators for more than 7 days and on average about 10 days. That's a lot of time for those muscles to get weaker and weaker, to the point that if they do get off the ventilator, their respiratory system and breathing muscles are so weakened that they are at higher risk of other complications and death just from that situation. So with that, there are exercises that we can do that have been well established in the physiotherapy world on strengthening our breathing exercise that we should all be doing now to prepare so that we don't have as much shortness of breath and need to go to the ER and avoid being put on a ventilator. So I'm going to go through those exercises with you now in hopes that people can start doing this and you can share it with those who you're also concerned about and give them away. Simply because a lot of people out there don't actually know how to breathe properly, and hopefully this will help. The primary respiratory muscle that we have is called the diaphragm. And it sits under our rib cage like a couple of domes, and as you contract, it flattens down and pushes our stomach out. And as we relax, it comes back in. At rest, in healthy people, it's responsible for 80% of our ventilation. Unfortunately, the best time to learn how to breathe through the diaphragm isn't when you're in respiratory distress, because a lot of other systems come on board that prevent that from being an easy thing to accomplish. So if you can get comfortable learning to breathe with your diaphragm now, you'll be much better situated if you do happen to catch COVID-19. So a quick shout out to all the yoga instructors out there who've been teaching diaphragmatic breathing for years. This is kind of kudos to you, and for those who've been taking yoga, this should be a lot of rehashing what you've already been doing. So to breathe with your diaphragm, put one hand on your stomach, one hand on your chest. As you breathe in through your nose. You want to push your stomach out, and then just let it relax as you come back to it. As you breathe in, usually between 3 and 5 seconds, I'm going to show you on the side view. So as you breathe in, just like that. Now it is surprisingly quite challenging. The reason why we've got a hand on the chest is because you don't want that to happen. You want that to happen. As long as the hand on the stomach is going further than the hand on the wrist, on the chest, you'll be doing all right. So the other thing is, as you breathe in, hold the breath there for 2 to 3 seconds. And as you breathe out, purse your lips a bit, so that it makes your exhale longer than your inhale, which helps calm the whole body and the whole system down, which makes it easier to breathe. So I'm going to go through 10 breaths with you. 1, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. 2, 3. 6, 2, 3. 7, 2, 3. 8, 2, 3. 9, 2, 3. 10, 2, 3. On this one, I'm going to breathe all the way out, and then I'm going to hold my breath out at the bottom. I'm going to hold that for about 10 to 15 seconds. And then take a full deep breath, hold it for a couple of seconds, and relax. So that exercise there, you can do that. I'd recommend at least 3 to 5 times a day, but you can do it every hour if you want. The key thing, you may feel a bit lightheaded. If that happens, then just as I did there, breathe all the way out and hold your breath out for between 10 and 30 seconds, and then breathe in. The reason why you feel a bit lightheaded is because you end up breathing out and blowing off all of your carbon dioxide, and so by breathing out all the way and holding that breath with the air out, it helps reestablish the normal levels of carbon dioxide in the blood. And you should feel quite calm and relaxed afterwards. There's also a couple of videos out there circulating on how to breathe if you've got COVID-19, which are great to do, again, to help kind of clear the lungs and get that going through. I'm planning on putting together a few other videos to help with some anxiety breathing, breathing if you do get COVID-19, and then if you get kind of further down, and we'll see how that goes. So again, thanks for watching, and please share with anyone who you think may help with some breathing exercise. Thanks.